was born and raised in the Pacific Northwest. This is my home. I spent 4 years of undergraduate at the University of Washington and stayed there for medical school and 7 years of ear, nose, and throat residency training. After that, I wanted to learn more advanced techniques in sinus surgery, so I spent additional time with P.J. Wormald learning to be a rhinologist. After that, I then joined the faculty at the University of Washington and practiced rhinology. Rhinology is a subspecialty within ear, nose, and throat surgery. I often say I'm the N person in ENT. And I treat all things related to the inside of the nose and sinuses, including chronic sinus disease, nasal congestion related to a deviated septum or turbinate hypertrophy, allergies, and even more complex things like recurrent nasal polyps and sinus cancer, as well as life-threatening disorders, including CSF or cerebral spinal fluid leaks. I still enjoy education and run several educational courses for ear, nose, and throat surgeons. As the past president of the Northwest Academy of Otolaryngology, I had the opportunity to organize several courses. One of my favorite courses is the Seattle Otology and Rhinology course. I co-direct this course every year, and we bring in outside faculty to help teach other ear, nose, and throat surgeons how to do better and safer sinus surgery. My driving philosophy in treating patients with complex sinus disorders and simple sinus disorders is to treat them the way I would want to be treated. I firmly believe that health is far too important to guess what is causing the problem. And to help me figure out these disorders, I often will need to perform a simple, quick, in-office nasal endoscopy or get a sinus CT scan. And oftentimes it takes both of those pieces of information to figure out what is the root cause of the patient's complaints. Once I can identify that problem, then I can design a patient-specific treatment plan to address that particular problem. In my free time, I enjoy the outdoor activities of the Pacific Northwest. I love mountain biking, hiking, climbing, skiing, scuba diving, mountain climbing, and I certainly enjoy spending time with my family. My most memorable patient, that's easy. That's VIP. VIP stands for Very Important Primate, and he's a 430-pound western silverback gorilla at the Woodland Park Zoo. And a few years ago, he was suffering from a life-threatening sinus infection. I ended up performing the world's first endoscopic sinus surgery on a gorilla. He was really sick, but fortunately after a lot of care, he survived and thrived, and both him and his girlfriend produced this amazing baby gorilla named Yola. And all three are doing well and at the Woodland Park Zoo today.